just beyond my comprehension why anyone would ever practice without a practice nurse. They're indispensable.
I have never worked without a practice nurse, and I would feel completely hopeless without having a practice nurse.
We're being more recognised than what we were before.
That was never the case in the early days. It was more the doctor told me what to do and I did it. 1994, I got the position in the general practice, and they'd never had a practice nurse before. I think we were just a nurse in a general practice setting, and we didn't even have the title of practice nurse in those days.
Because originally there was no backup for us, there was no support. We were pretty well an island to ourselves.
With the evolution of the position over the last 17 years for me, there were no practice nurse item numbers when I first started. So having gone through no practice nurse item numbers to many, many years with them.
The practice nurse item numbers basically really relied on throughput. What this package is about really is quality care and supporting GPs.
Now we're going through change again, and change is always good. Change is hard for a lot of people, but change is good. And we can see that I see that it will work beautifully, this block funding, because it won't restrict us in one particular area.
Any change brings anxiety, and over the years, the time I've been here, the role has just changed so much. And I went from GPs wanting to have a nurse here but not quite wanting them to do anything, and not quite wanting to let go of, not power, but some of that control.
Lifestyle intervention program that we've developed through the auspices of one of my nurses who has a specific interest in this area, who pushed and pushed and pushed until we finally caved in and gave in to her, and that's been a real success.
The obstacles and barriers I had to set up this work within the practice, it's all been worthwhile.
I've had a cholesterol problem for years, and they suggested to me to see Marion after I'd done the blood test. Well, if I didn't come and see, I would have been same track or worse. Simple as that.
So thanks for coming back, and I look forward to seeing you again in September. So fantastic, keep up the good work. Good on you. Thanks.
With a diabetic patient, pre our diabetes clinic, I would have spent 15 to 20 minutes per consultation with the patient. Judy, one of our practice nurses, now sees the patients and does all their measurements and talks to them. They come in to see me, and I'm then able to do what I'm best at doing.
It means we're offering a whole lot of advice that normally they would get a sort of 1 minute spiel from me because we've run out of time and it's the end of the consultation, whereas I can book them in to see her and she can spend a lot more time and probably better advice than I would be giving.
But I think it's moving more towards having that multidisciplinary team and working in collaboration. I mean, nurses naturally work in collaboration, both with GPs and with allied health and with other nurses. So it's a very natural thing for them to do.
It's opened up our books. We had a 6-week waiting period. With our involvement in collaboratives and with having practice nurses, we could get patients in quicker to see the doctor.
The scope and scale of things that nurses can do is unlimited, and we're only just scratching the surface, I think, of what we can get our practice nurses to be doing.
As doctors, we were trained on single event incidents, and in the last 20 years, I guess it's changed, where you're becoming a little bit more of the specialist, where you come in, somebody comes in and is talking about their diabetic management, but it always gets confused by the infection or the sore throat or the ruptured eardrum, and it takes you back that moment where the RN comes in and says, well, this is the plan, we've actually got to follow the management and improve the management of the patient. And I think that's, for us, it's been great, and that's the changing role of medicine. I think that fits in very well.
I think nurses are very good at setting up systems, and they're very good at streamlining services.
Practice nurses do and do well, and I think that this is another future direction in which practice nurses is going, and that is to navigate the system. And when I talk about coordinating care, really it's navigating the system, and navigating the system allows the patient to access the services.
Right, there's this cascade of good, healthy advice getting out there.
The patients benefit from it. They love to see the nurse. They feel it's different.
Really good to see some positive changes.
It's just changing old views and ways. And it's like lifestyle medicine. It's a habit change, you know, getting from the old into the new, and do it gradually. Because the patients were very trusting of their GPs, but now they suddenly had to let go and hand over some of that trust.
Financially, if it becomes non-viable and we lose practice nurse time, then that will be of great detriment to the practice, and we would probably reduce our personal take-home pay to stop that happening.
Well, it's really good that we're being more recognised than what we were before. I think that's the single most important thing that's happening as far as I'm concerned.
It's much more of a family feeling. We all care about each other and we care about our patients. So yeah, it's making me feel a bit emotional.
She's kept me very comfortable and she's very reassuring too. She's fun too, yeah.